During the month of November, the Cincinnati VA Medical Center is shining a light on the most common type of non-skin cancer in men, prostate cancer. Here to talk about it is Dr. Natalie Singer, staff urologist with the Cincinnati VA Medical Center. And Dr. Singer, thanks for being here today.
No, thank you for having me.
How is the VA Medical Center making sure that prostate cancer is front of mind for our local veterans?
Well, all men should be thinking about prostate cancer. It's a very common cancer in the male population. 1 in 8 men will develop prostate cancer over their lifetime. And especially in our veteran population, we know the Vietnam generation with Agent Orange are at much higher risk of high-grade prostate cancer. And so it's really important for them to talk to their primary care doctors about prostate cancer screening. Prostate cancer screening is recommended typically between the ages of 50 and 70 to 75 in men of average risk. And so men who are of average risk are most American men, but there are a few populations who are going to be at higher risk for prostate cancer who should be talking to their primary care doctors about earlier screening. Men of African American ancestry, so they have a much higher risk of high-grade prostate cancer. Men who've been exposed to the Agent Orange have a higher risk of high-grade prostate cancer. And men who have strong family histories of prostate and or breast cancer, such as like a first-degree relative, like their mother or their father with prostate cancer or breast cancer diagnosed at a young age, there are genes that can predispose patients to having prostate cancer in that population. We commonly think of it with breast cancer, those BRCA genes, but it also puts men at risk for prostate cancer. So they should talk to their primary care doctor about getting screened earlier, typically around the age of 40 to 45.
So how can veterans get screened for prostate cancer?
That's a great question. Really, it's, again, talking to their primary care doctors through the VA. They talk to them about, should I be screened, and what the screening methods are, which is typically just a blood test and a rectal examination. If either of those are abnormal, you then would be referred to someone like me in urology who would talk to you about what those things mean and if a biopsy or further testing would be indicated.
And Dr. Singer, what happens if a veteran is diagnosed with prostate cancer?
If they get the diagnosis of prostate cancer, they typically meet with me or one of the other prostate cancer surgeons here at the VA, and we'll sit down and have a long visit discussing what the diagnosis means and what we think the best treatment option for them is. Prostate cancer is, quite honestly, one of the most difficult things to counsel on that we treat because there are so many options available, and it's not a one-size-fits-all. People with lower risk cancer often will just watch them with a program called active surveillance, where you go in for frequent blood tests and maybe prostate MRIs and biopsies just to monitor the cancer. But people with more aggressive cancers can be recommended sometimes for surgery, radiation, or even ablative treatments.
And you're ahead of the curve at the VA Medical Center when it comes to how you treat prostate cancer, right?
Yeah, well, and it is very interesting because, I mean, this has only come about in the last few years because of prostate MRIs. Prostate MRIs is a newer way of helping to diagnose prostate cancer because with traditional ultrasounds, biopsies, you know, the ultrasounds are kind of fuzzy images and they don't usually show a discrete mass. But we have found ways with newer MRI technology to target areas of abnormality that are often prostate cancers when we do the biopsy. And if you only have prostate cancer in an area of abnormality on an MRI, we have gotten to a point where we can actually just talk about treating that area rather than going through the side effects of having your entire prostate treated with the cancer treatment, because the prostate cancer treatments all have side effects. They often impact urinary symptoms and can cause erectile dysfunction, and that's why many men choose surveillance when they have lower risk prostate cancer, because that risk benefit of treatment's not always there. But in men with more advanced prostate cancer, treatment is a benefit.
We want to do our part to spread awareness. If a veteran's watching this and wants to schedule a screening or learn more, how can they do that?
Start with their primary care doctor. And there'll also be more information upcoming on a lot of the VA websites as far as how to reach out and get more information on prostate cancer screening here.
Sounds good, Dr. Singer. Thanks again for sharing this information with us today.
Yeah, no problem. Thank you.